Good evening, and thanks for joining us. I'm Kate Sullivan.
I'm Rob Johnson. Illinois Governor Pat Quinn quietly eases the requirements for a mandatory 21-day Ebola quarantine.
He did it by clarifying what direct contact meant, but he's still at odds with the White House. Chief Correspondent Jay Levine is here with a medical issue that's sort of become a political football, Jay.
Yeah, Kate and Rob, with medical decisions driven not by science, but by public concerns and by politicians involved in hot campaigns. The White House continuing to question calls for quarantines of those showing no Ebola symptoms. The Centers for Disease Control this afternoon agreed.
Those who have been directly exposed to Ebola, who have been in high-risk health situations, when they arrive, if they do in Illinois, there will be a 21-day period, mandatory.
Quinn was on the campaign trail announcing the creation of 500 new jobs with the help of a $2.5 million state grant. We found his opponent, Bruce Rauner, on the southwest side with his wife, Diana, and asked whether he agreed with Quinn's quarantine.
I think it's long overdue. We should have called for them earlier.
It was the case of the returning doctor in New York who developed symptoms after returning from Liberia, which prompted the call for quarantines for those without symptoms, and the protests of a returning nurse quarantined without symptoms over the weekend that added fuel to the fires.
All it is doing is it is building up the concept of fear.
And you're saying that these quarantines are political, not medical?
I believe that they are. If a person is, is clear and if they are showing no symptoms, then there's no reason for them to go into a quarantine.
The CDC this afternoon seemed to agree quarantines were probably not necessary, recommending voluntary home stays. The Illinois Department of Public Health limited those subject to mandatory quarantines, defining high-risk contact as direct physical contact with blood or body fluids of Ebola patients and victims. But Bishop Wilkowski also warned about other consequences.
Quite frankly, if I were a doctor, I would think twice.
Because?
Why do I want to come back here and then be placed in a political quarantine?
Political in a sense that decisions were driven by voters' fears rather than medical evidence. And right now, Quinn and Rauner have to listen to the voters. Rauner, like some other Republicans, did want to go a step further, calling for a ban on all travel to Ebola-infected areas. Mayor Emanuel, who supports the Quinn quarantine, said that was up to the feds.
This is really a balancing act here, Jay, that you just talked about. Do you think the people will accept this? That, a lot of it's driven by fear, but not necessarily by medicine, as you just alluded to.
It's their fears, Rob. And right now, when you've got voters who want to go to the polls next week and decide who they want to vote for, the question is, how much do they fear Ebola? How much do they think just lock them all up, put them away until 21 days has passed, regardless about whether there's any real need for it? That's what the White House says.
Well, and I think this has been exacerbated by the fact that some people who were supposed to be quarantined nationally have ignored that and gone out, and that has caused fear.
Well, they're not necessarily those who wanted to be quarantined. It's people who developed the systems afterward. And what doctors are saying is you have to rely on medical health professionals. If they develop a system, immediately they take themselves to the hospital, don't come into contact with anybody.
Boy, interesting discussion for sure. Thanks.